Hello guys, today we are going to discuss about portal hypertension. Right before talking about the portal hypertension, we should know the portal system, portal circulation, so as to understand the portal hypertension. So let's talk about in a very nutshell about the portal system, okay, so that we can understand this portal hypertension. So just bear with me, everything will be clear, okay. So I'm going to draw a rough diagram of the portal system, okay. So let's suppose this is a lever, guys. Let's suppose this is a lever, okay. Okay, so this is lever and how the portal system starts, and this is the IVC, okay. And let's draw here our heart with 4 chamber. This is just a rough diagram, okay guys. And the inferior vena cava is going to drain the blood into deoxygenated blood into right atrium, okay. And this is the liver. So portal system, we are talking about the portal system. Let's suppose this is spleen. This is our beautiful spleen, okay. And shown here is our mesenteric, okay. So the portal vein is formed by splenic vein, okay, and superior mesenteric vein. This is superior mesenteric vein. I'm writing in a short form. Superior mesenteric vein. These two veins forms the portal vein. So this is our portal vein. Portal vein. Guys, before entering into the heart, the portal vein divides into two parts. That is left and right. Left and right portal vein. So this is right portal vein and this is left portal vein, okay. Left and right portal vein, okay. So this is our portal vein, guys. This is our portal vein. So portal vein is formed by superior mesenteric vein and splenic vein. So this is a splenic vein. So this is very important to understand the portal hypertension, guys, okay. So if you talk about more, let's talk about this one. Then the portal vein divides into left and right portal vein, and that is anastomosis, that gets anastomized with the hepatic vein, guys, hepatic vein. So we have 3 hepatic veins, a right hepatic vein, left hepatic vein, and another one is a middle hepatic vein, okay guys. So this is right hepatic vein, left hepatic vein, and this is the middle hepatic vein, okay. So these right portal vein and left portal vein anastomosis with the microspecial structure with the right hepatic vein, left hepatic vein, and the middle hepatic vein, and that structure is known as sinusoids, hepatic sinusoids, guys. The superior mesenteric vein, splenic vein combine to form the portal vein, which divides into left and right portal vein, get anastomized with the right, left, and middle hepatic vein to form the hepatic sinusoids. And one thing important about the hepatic sinusoid I'm going to mention here, it has more compliance. It has got more compliance, means ability to hold more bloods, okay, and less resistance as compared to the systemic venous system, okay. Less resistance, okay guys. So this points are going to help us to understand the portal hypertension. Okay, guys. And if you wanna add some extra point, the inferior mesenteric vein drains into splenic vein, guys, drains into splenic vein. Okay, and we have here, let's suppose this is our umbilicus. Okay, guys, this is umbilicus. So umbilical vein, and here is our gallbladder, right? Gallbladder, GB. Okay, so cystic vein from the gallbladder, cystic vein drains the blood into right portal vein, whereas umbilical vein drain the blood into left portal vein, guys. Left portal vein. Okay, so this is our umbilicus. Are you getting, guys? Why I'm mentioning these things? Because on the D course of the portal hypertension study, we will be knowing about the caput medusa, which will form the portosystemic shunting between the paraumbilical veins with the superior systemic epigastric vein, systemic superficial epigastric vein. Okay, we'll be later on discussing about that thing. First of all, understand this. This is our portal venous system. Portal system, we can say. So this will be quite easier. Portal hypertension will be easier if you understand these things. Okay, guys. So far we discussed about the portal system, and normally what happens in the portal vein? Normal the pressure of the portal vein, venous pressure is 5 to 10 mm of Hg. Okay, guys, 5 to 10 mm of Hg, and some book mentions that 5 to 8. Okay, but on an average we can take 5 to 10. Okay, mm of Hg. Okay, guys, with the venous, hepatic venous pressure gradient very minimal, or with a small hepatic venous pressure gradient which is usually less than 5 mm of Hg. 5 mm of Hg, less than 5 mm of Hg, guys. Okay, so this is the normal, and if you know the normal, then definitely we can see whether any deviation from these values may give rise to the portal hypertension or abnormality. Okay, so now let's talk about the portal hypertension. After getting through the portal system, we are going to discuss about the portal hypertension. Okay, guys, let's get started. Let's start. So this is our portal system, portal hypertension. What is portal hypertension? If we talk about the definition of portal hypertension, I'm just gonna give you the values rather than defining in a very beautiful language. Okay, so when there is a pathological elevation, so there should be the pathological elevation of portal venous pressure. So as you have learned here that up to 10 is normal, so more than 10 should be abnormal, but usually in a definition we say that the portal venous pressure is usually greater than 12 mm of Hg mercury. Okay, guys, so when the portal venous pressure is more than 12 mm of Hg, we can say portal hypertension. Okay, or in USG, if the portal vein diameter, I am writing PV, portal vein diameter greater than 12 mm is also portal hypertension. Okay, or we can define in a very specific way that the hepatic venous pressure gradient greater than equal to 6 mm of Hg, is also hepatic portal hypertension. So we can define the portal hypertension in the three different ways. Either the portal venous pressure should be greater than 12 mm of Hg, or the portal venous diameter should be greater than 12 mm or millimeter. Whereas or also we can say the hepatic venous pressure gradient should be greater than equal to 6 mm of Hg, because we have already talked the portal venous gradient is usually less than 6 mm of less than 5 mm of Hg. So less than 5, so greater than 5 is 6. Okay, so greater than equal to 6 I have written here, hepatic venous pressure gradient. Okay guys, okay, so this is a definition which is usually presented with the clinical manifestations TRAD, we can say. So TRAD of portal hypertension is ascites, splenomegaly, okay. So this is something very important you should know about the clinical manifestations. Okay guys, and last but not least of the TRAD is, we can say here, esophagovarices. So these are the three clinical points we can get during the case of portal hypertension. Okay, so now let's move on to the causes of portal hypertension. Okay guys, causes of portal hypertension. So when we talk about the causes of portal hypertension according to the site of abnormality, guys, so let's talk about the prehepatic and extrahepatic, we can also say. So understanding this concept, let's talk somewhere out here. Okay guys, so let's suppose this is our liver, guys, so this is our rough diagram of liver. So here is the somewhere is the sinusoids, hepatic sinusoids, and here it starts the hepatic veins, and that drains into IVC, that is inferior vena cava, and here is our portal vein. Okay guys, so if you are encountering the pathology of the portal hypertension before the sinusoids, so the portal system, it starts, the origin of portal system is neck of pancreas, origin of portal vein. So if you are if there is abnormality in this region before the liver, which is medical term as a hepatic, that is prehepatic, we will say prehepatic in a term of, I am comparing these things in a term of liver. Okay, so if there is some blockade or pathology in the portal vein, then it is prehepatic. Okay, if it is happening in the liver, within the liver, this is intrahepatic. If the pathology is within the liver, that is intrahepatic. If the pathology is beyond the liver, this is post-hepatic. You got my point, guys? Post-hepatic, behind the liver. Okay, so this classification is on basis of the liver, but if you talk about the sinusoids, then you can see here this can also, prehepatic can also, because sinusoid is in the liver, so we can say prehepatic is also is extra hepatic. This is extra hepatic, no, guys, because this is outside the liver, so this is extra hepatic pre-sinusoidal, because it is prior to the pre-sinusoidal sinusoids. Okay, pre-sinusoidal. And in case of intrahepatic, it can there is three types. Okay, so there is three types within the liver, but prior to the, within the liver means intrahepatic, and but prior to the pre-sinusoidal, prior to the sinusoid, so pre-sinusoidal. And another is the sinusoid within the pathology, can be within the sinusoids, sinusoidal. And another is the post-sinusoidal, but within the liver, sinusoidal. And whereas the post-hepatic one, which is beyond the hepatic liver, so this is extra-hepatic, and post-sinusoidal, because this is after the sinusoids and outside the liver, so extra-hepatic, post-sinusoidal. You got my point, guys? Okay, let's move here. So now let's talk about the causes of the prehepatic one. Okay, so what are the causes of portal hypertension in a prehepatic or the extrahepatic pre-sinusoidal? The first we can say here is a portal vein thrombosis. Portal vein thrombosis. So if there is a thrombosis of portal vein, this can lead to the portal hypertension, and this can be either primarily because of sepsis, or secondly because of the cirrhosis. So we encounter the portal vein thrombosis either because of the sepsis or the cirrhosis. Okay. Another one is a malignant disease of either liver, either a disease of pancreas, guys. Okay, malignant disease of pancreas, or we can say even in case of the pancreatitis, we encounter the prehepatic cause of the portal hypertension, pancreatitis. Okay, even in congenital cause can also be there, congenital cause. So this was for the prehepatic one. Now let's talk about the intrahepatic. I have already told you here. In the intrahepatic there is three types, right? So same thing has been here written. So pre-sinusoidals, guys, pre-sinusoidal. Okay. So in pre-sinusoidal we can encounter like schistosomiasis, okay, schistosomiasis. Okay, guys, schistosomiasis. This is schistosomiasis is one of the cause of the pre-sinusoidal, which is intrahepatic one. Okay, pre-sinusoidal, intrahepatic one. And even the granulomatous diseases like granulomatous diseases like either TB or sarcoidosis. Okay, sarcoidosis. So sarcoidosis can also cause the pre-sinusoidal intrahepatic portal hypertension. And talking about the sinusoidal, so in the sinusoidal, it can either be because of cirrhosis, especially seen in alcoholic patients, okay, and cystic liver diseases. So in pre-sinusoidal, we can learn with the SS2. You can learn only two causes as well, like cystosomiasis and sarcoidosis SS, and sinusoidal cystic and cirrhosis and cystic liver disease. Okay, in the post-sinusoidal, intrahepatic post-sinusoidal, we can write veno-occlusive diseases. Veno-occlusive diseases can cause this pathology. Okay, veno-occlusive diseases. Even in here, we can say drugs as well. So drug induced may also cause drugs like methotrexate. Okay, and even the copper toxicity can lead to the liver parenchyma diseases like Wilson's disease. Okay guys, and the post we talk about this one thing. Okay, and even in the post sinusoidal, we can say sclerosis of the hepatic vein also. So sclerosis of hepatic vein. We should not learn all the examples, just to learn the veno-occlusive disease, post-sinusoidal, cirrhotic, this one, and sarcoidosis. Okay, now let's talk about post-hepatic or the extra-hepatic post-sinusoidal. Okay, so first is bird cherry syndrome. So guys, you know what is bird cherry syndrome? So we should not know much more about this, but just have an idea about the bird cherry syndrome. It is a condition of the hepatic vein obstruction, where we can encounter in a bird cherry syndrome, the hepatic vein will be occluded, obstructed. That leads to the hepatomegaly, ascites, even the abdominal discomforts. Mostly it is caused by the thrombotic occlusions. Okay, secondary to any types of chronic myeloproliferative neoplasms like polycythemia vera, but can also be caused by other conditions. But let's not talk about that. Like the other conditions may be hypercholesterols as well. Okay guys, so this is the bird cherry syndrome, and in this syndrome we encounter the hepatic vein obstruction. Okay, that is because of the most common because of the myeloproliferative neoplasm. Okay guys, and we'll also encounter in a constrictive pericarditis. Okay, constrictive pericarditis, and also the right-sided heart failure. Right-sided heart failure. Okay, and even the obstruction of IVC. So guys, this is the about the portal hypertension causative factors, etiology, and in the next video we'll be talking about the clinical features of portal hypertension and diagnosis of portal hypertension and the treatment of portal hypertension in the subsequent videos. Thank you.